Today we will learn about Sheehan syndrome. This Sheehan syndrome it is seen in because of postpartum hemorrhage in the mothers. Postpartum hemorrhage during or after delivery it causes hypovolemia, and because of this it leads to decreased blood flow to the pituitary, and there is ischemia and necrosis of pituitary gland which damages the pituitary, and there is a hypopituitarism. And because of that hypopituitarism, there are certain signs and symptoms are seen in postpartum women. The first clinical feature is there is a no lactation. Inability to breastfeed is the earliest clinical feature of Sheehan syndrome. Then the late clinical features are secondary amenorrhea, fatigue, weakness, loss of pubic and axillary hairs, cold intolerance, low blood pressure, depression, low libido, weight gain or weight loss. All these features are because of hypopituitarism, because of decrease in the levels of the prolactin, growth hormone, thyroid hormone, adrenal insufficiency, because of decrease in ACTH. All these symptoms are because of hypopituitarism. Then we can diagnose this early by, if there is a early clinical feature like failure to lactate is there, then we have to diagnose it as early as possible with the help of, we can do blood test where we can find out decrease in pituitary hormones like T3, T4, prolactin, growth hormones, estrogen, cortisol, and if we do MRI of the brain, there is a empty sella turcica because of necrosed pituitary gland. Then treatment, in this we have to give lifelong hormone replacement therapy to the patient. So that's all about Sheehan syndrome, which is because of postpartum hemorrhage which leads to hypovolemia, and because of that hypovolemia pituitary is damaged because of ischemia and necrosis which leads to hypopituitarism, and because of hypopituitarism there are certain clinical features are there which is called as Sheehan's syndrome. So that's all. Thank you.